I'm a neurourologist and a reconstructive urology surgeon, and my focus is both on the neurogenic patients and the urinary tract and urinary dysfunction issues that they do have, from leakage of urine all the way to urinary retention, problems that can happen to kidneys for them. I also focus on the non-neurogenic patients' urinary incontinence issues from different angles. Either it is related to their bladder or their urethra or support of their urethra. One of the main projects I'm running these days is focused on understanding female urethra dysfunction. Female urethra is basically a 5-centimeter tube that connects the bladder to the outside, and currently in none of our treatment options that we do have for incontinence or leakage of urine for women, this dysfunction is addressed. Our current treatments are only focused either on the support around the urethra using a mesh or sling or fascial sling, or it is focused on the bladder for overactivity and calming down the bladder in urgency incontinence. My research is basically understanding how urethra dysfunction plays a role in the middle of this whole incontinence picture. And if we do have potential options that we can develop to augment the other treatment options that we do have, or maybe introduce safer options with more long-term efficacy for patients. We do have animal models in the lab working on the urethra aging of mice at this point, and we are working on mechanistics of aging impact on urethra, because as we know, 50 to 60% of women around the world throughout their life will suffer from urinary leakage. That means from every 2 women, 1 is going to have some level of urinary incontinence. So it's a big problem. 1/4 of our population is impacted by it. And we really need better and better options with least side effect for these patients.